What is vitamin D? Vitamin D is one of the fat-soluble vitamins and is also called the sun vitamin, because the body synthesizes it when exposed to the sun's ultraviolet rays, and sunlight is the most important factor in the synthesis of vitamin D by the body through the skin. We will get acquainted with the types of vitamin D, its sources, appropriate dosages, the normal rate of vitamin D in the body. Types of vitamin D. There are two main types of vitamin D, namely vitamin D2, ergocalciferol, found in some plant sources. Vitamin D3, cholecalciferol, it is found in animal sources. It is often recommended when choosing vitamin D supplements to choose the types that contain cholecalciferol or vitamin D3, as the metabolic processes that take place in the liver differ for both vitamin D2 and D3, and the effectiveness of vitamin D3 is likely to increase compared to vitamin D2. It is the natural form that is made in the body when exposed to sunlight. Sources of vitamin D. There are many sources of vitamin D between natural and unnatural sources, and it is preferable to get it from its natural sources. So where is vitamin D? Below we list the most important sources of vitamin D. The sun. The sun is the main source of vitamin D, as sufficient exposure to it daily for at least 15 minutes contributes to stimulating the production of vitamin D3, cholecalciferol, in the skin under the influence of ultraviolet radiation, while vitamin D2, ergocalciferol, is produced in plants, and is found in foods fortified with vitamin D. Foods containing vitamin D. The body can synthesize sufficient amounts of vitamin D, but a person may not get enough of it if he is not sufficiently exposed to sunlight, or if the body has difficulty absorbing vitamin D. All this leads to a deficiency and the appearance of symptoms that result. So the body can get vitamin D from some foods, the most important of which are fatty fish. Fatty fish is a good source of vitamin D, such as salmon, 100 grams of which contains about 526 IU of vitamin D. Other examples of fish that contain vitamin D in good quantities are trout, mackerel, tuna and eel. Canned tuna. Fresh fish is not the only way to get vitamin D, as vitamin D is also found in canned tuna and sardines, where in 100 grams of canned light tuna there are 268 IU of vitamin D, while 100 grams of canned sardines contain 193 IU. Certain types of mushrooms. Mushrooms have the ability to produce vitamin D when exposed to ultraviolet radiation, but there are species that are grown in the dark, and therefore do not contain vitamin D. However, some specific brands grow mushrooms under ultraviolet radiation to stimulate the production of vitamin D. Fortified milk. Milk does not contain vitamin D naturally, but most types sold in the markets are fortified with it. Sometimes soy milk and rice are also supported to compensate for the lack of vitamin D in them. Some types of orange juice. Some types of orange juices are fortified with vitamin D. Usually 1 glass of fortified orange juice contains about 100 IU of vitamin D, but the amount varies depending on the brand. Egg yolks. Egg yolks are also sources of vitamin D, so it is important to eat whole eggs and not just whites, as the yolk of one egg contains about 37 IU of vitamin D, but it is not recommended to try to get the body's daily need of vitamin only from eggs. Fortified cereals. There are some types of low-calorie cereals fortified with vitamin D that help the body get part of its daily need of the vitamin and prevent its deficiency. These pills can be taken with fortified milk, as milk also contains calcium. Beef liver. Beef liver contains many nutrients, and 1 serving of cooked beef liver contains about 50 IU of vitamin D, as well as vitamin A, and iron. Cod liver oil. 1 tablespoon of cod liver oil contains about 1,300 IU of vitamin D, which is more than twice the daily need, 600 IU per day. UV lamps. People at risk of developing vitamin D deficiency or people with symptoms of vitamin D deficiency due to poor absorption of vitamin D by the body may resort to treatment with exposure to UV-emitting lamps. But these lamps have risks, such as skin diseases and skin cancer, and they also need protective glasses, so it is preferable to use this method only on the recommendation of a doctor. Dietary supplements. Vitamin D dietary supplements are available in the form of oral drops, syrups, vitamin D pills, and needles for intramuscular injection. The benefits of vitamin D. Vitamin D is one of the most important vitamins involved in the metabolism of bone building. By facilitating the intestinal absorption of calcium, vitamin D also contributes to the transfer of calcium from the intestine to the blood by proteins called calbindin-salbindin. It also stimulates the absorption of magnesium and phosphate. In addition, vitamin D normalizes calcium and phosphorus levels in the blood, helps bones increase calcium absorption, thereby enhancing bone strength and density, preventing osteoporosis and thinning, rickets. It is worth mentioning that vitamin D protects against calcium deficiency and bone problems in patients with kidney failure. Other important benefits of vitamin D include reduced digestive disorders, especially irritable bowel syndrome, prevention of multiple sclerosis, English, multiple sclerosis, as adequate levels of vitamin D in the blood contribute to the prevention of this disease. Regulate insulin levels in the body, reduce the risk of developing type 1 diabetes. Increased chances of pregnancy after insemination or artificial insemination in women who are not deficient in vitamin D compared to those who are deficient. Enhance fertility in men by improving testosterone levels, as well as improving the quality of semen. Maintaining the integrity of the expectant mother and the fetus, avoiding premature birth, preventing deformation of the bones of the fetus. It is recommended to give vitamin D supplements to infants from birth under the supervision of a doctor, as mother's milk does not provide them with a sufficient amount of it. Strengthen immunity, protect against cancer and chronic diseases, especially in the elderly. Vitamin D also reduces the risk of immune diseases, and its deficiency is associated with an increased risk of autoimmune diseases and susceptibility to various diseases. Relieve the symptoms of premenstrual syndrome with calcium supplements, as vitamin D helps reduce the excess production of hormone-like substances called prostaglandin, that cause pain associated with menstruation, which contributes to reducing this pain. Stimulation of old hair follicles, increase and stimulate the formation of new hair follicles, as well as it is believed that there is a relationship between alopecia and vitamin D deficiency.